Good afternoon. Today I'll be talking to you on retinitis pigmentosa, a very important congenital retinal dystrophy. Pigmentary retinal dystrophy is the name designated to this, but retinitis pigmentosa is now, although commonly used, the correct description would be rod cone dystrophy. Rod cone dystrophy. So retinitis pigmentosa, as the name indicates, there is some abnormality in the retinal pigmentation. It can be genetic, inherited, and it can cause diffuse retinal degeneration. It initially affects the rods and later the cones. Basically, the photoreceptors are affected. Firstly, the rods and then the cones is the most common hereditary fundus dystrophy. It occurs because of mutation of the rhodopsin gene, and there are abnormalities of photoreceptors and retinal pigment epithelium. This can only be a spillover. Photoreceptors is the primary problem. So this is the picture of a patient with retinitis pigmentosa. You can see three classical things. In every patient, the classical features will be present, such as a waxy pallor of the optic disc. This is the waxy pallor of the optic disc, what you're seeing here, the arrow pointing to. Then these are the bony corpuscles. What the entire mid-peripheral retina shows blackish spider web-like deposition of pigments. This is the bony corpuscles. And the third is the attenuation of retinal arteries. Now, in this photograph, you can hardly see the retinal arteries, which indicates that they have become thread-like. So, arterial attenuation is another very important feature. What we are seeing here as vasculature is only the retinal veins, because we are not able to make out the retinal artery. So this triad, arterial attenuation, presence of bony spicules and waxy pallor, is the triad of retinitis pigmentosa. The inheritance can be sporadic or it can be inherited. When it's sporadic, it has a reasonably favorable prognosis. Inherited can be autosomal dominant, autosomal recessive or X-linked recessive. Autosomal dominant has the best prognosis. Autosomal recessive is very severe and blindness occurs quite early in life, but X-linked recessive is the most severe of all, and it is associated with a least common manifestation. So, in other words, the inherited or the inherited part of the disease can be autosomal dominant, recessive or X-linked. If it's dominant, it has best prognosis, but it is not very common. X-linked recessive is the least common, most severe. Autosomal recessive is severe as well. These patients, what are the symptoms? They come to us with loss of night vision, which is also called nyctalopia, the loss of peripheral vision, photopsia, which is flashes, legal blindness and complete blindness in the later stages, and family history of RP is usually present. So this is how a patient will present. This is the visual field, which is a very classical description. Initially, the patient may have a normal visual field, but slowly the visual field starts to narrow down. There is what we call a classical ring-shaped scotoma because of the distribution of the bony corpuscles. If you can recall in this picture, the bony corpuscles are present in the mid-equatorial region. Beyond this, on both sides, there is no pigmentation. So this corresponds to the classical ring scotoma. These patients at the mid-equatorial region, they start having the scotoma, which can become worse as time progresses. In the early stages, it may be normal, becomes worse, and towards the end, you get what you call tunnel vision. Tunnel vision because the entire periphery is gone and the patient can see only the center. So this is what you call a ring-shaped scotoma. At this stage, you call it a ring-shaped scotoma. So the importance here is that these patients with retinitis pigmentosa may not complain of decreased visual acuity. The macula, as long as it is not affected, these patients retain reasonably good central visual acuity, and however, the visual field will show classical changes such as ring-shaped scotoma or tunnel vision. So these definitions are something that we need to know. Legal blindness or economic blindness refers to a vision of less than 660 with a visual field of about 20 degrees. So legal blindness and economic blindness is almost accounts. When we say economic blindness, we're talking about ability to count fingers less than 6 meters, not unable to count fingers less than 6 meters. Legal blindness is when vision is less than 660 with visual field of 20 degrees of visual field remaining. Whereas social blindness means, this is another important term, social blindness is when the visual acuity is less than 3/60. So this is also an important term that we need to know.